This medicine to ECG review will focus on case number 241 from ECG Wave-Maven. Copyright information is provided here. A 76-year-old woman who has had severe asthma since age 18 comes to the emergency department complaining of increased shortness of breath. Which one of the following statements is true concerning her admission ECG? The answer: there is evidence of right ventricular hypertrophy. We see a sinus rhythm with a relatively fast resting rate at about 93 beats per minute. The PR interval is normal at approximately 0.1 seconds, and the QRS axis is approximately 180 degrees. We see it's biphasic in lead AVF and positive in lead AVR, and thus dramatically deviated to the right. The R wave progression is reversed, with tall right precordial R waves and an RS complex in the left chest leads. Recall that in a normal ECG, there is an RS complex in lead V1. The R wave becomes relatively larger and the S wave smaller in lead V2. The ratio of the R wave to the S wave becomes 1 at the so-called transition zone, usually in lead V3 or V4. By lead V6, the QRS complex has usually evolved to become a QR complex. This process is referred to as normal R wave progression. In this ECG, however, we see there is a QR complex in lead V1 and an RS complex in lead V6. There's an incomplete, not complete right bundle branch block. The tall right precordial R wave, as well as the right axis deviation, are essentially diagnostic of right ventricular hypertrophy. The STT changes in the leads V1 to V3 are also consistent with RV overload, sometimes called an RV strain pattern. The P waves in lead 2 are slightly peaked, but do not meet strict criteria for right atrial overload, 2.5 millimeters or more in height. Right ventricular hypertrophy occurs over time in response to pressure or volume overload and conditions such as primary pulmonary hypertension, COPD, pulmonic stenosis, and atrial septal defect. This patient was diagnosed with an asthma exacerbation superimposed on severe COPD and improved with oral steroids and albuterol nebulizer therapy.